Good afternoon, everyone. This is Mayor Steve Haggerty. I'm glad to have all of you here joining us for another coronavirus Q&A. I am excited today to have Christopher Vasquez, a Daily reporter who is a Northwestern student. He's a junior for the Daily Northwestern, and he's coming to us from New Jersey, and Dr. Sarah Rodriguez, who's a professor at Northwestern. And the two of them recently collaborated on a multimedia history project for the Daily Northwestern, which is phenomenal. And I'm going to ask Christopher at the beginning to let you all know where you can find this, because it was 10 minutes and I learned a ton. And in fact, it inspired me to want to have this conversation today with Sarah and Christopher to share information with all of you. I think there's a lot that we can learn from history. People talk often about this being an unprecedented pandemic, as if we've never had a pandemic before, and we have. And you're going to learn about that today. We're going to talk about the 1918 H1N1 influenza that killed over 600,000 people here in the United States and over 50 million people around the world. So there's a lot we can learn, and I'm excited about the show. So first thing I'm going to do is I'm going to ask Christopher to share with people how you came up with this idea and why you thought this would be something that's valuable and important to report, and then where folks can find it, because I want them to be able to see the multimedia video as well that y'all did.
Yeah, so as things kind of started getting shut down, I was definitely feeling pretty scared and not really sure what was going to happen next. So the 1918 flu at that point was kind of starting to get a bit more archival news coverage. And so I started just kind of consuming that all the time to sort of give myself just a sense of comfort and see we have been maybe not exactly here before, but we have been in a pretty similar place. And so I just got curious to see how that played out in Evanston and how I might be able to use video as a tool to communicate that.
And so where could folks find the video if they wanted to actually watch this and it's a great 10-minute video. I can't stress enough how impressed I was with it.
So people can find it on the Daily Northwestern's YouTube page. They could also go to dailynorthwestern.com and click on the video tab, and it should be under there somewhere.
And what was the name? If they just Google it, what was the name of it?
What Evanston's response to the 1918 flu can tell us about COVID-19.
Excellent, excellent. So Sarah, talk to us about 1918, like what was the initial public and government response to that influenza?
So if you're talking about the United States?
Yeah, let's go with the United States. And then specifically, let's go with the United States. And if you can drill down even a little further to Evanston, I think that people would love to hear that.
Well, I'm going to actually say two things about Chris's work. One is that he pulled me in for an interview, but everything about Evanston was what he did. So it is a very impressive piece. But that said, and I thinking largely about the United States, that there were differences. Different cities handled things a bit differently. Some did sort of similar things, but a lot of cities were a bit different. Some cities really sort of closed down to anyone outside the city, so no visitors. Some cities didn't really shut down that much, or some cities shut down the school systems, others didn't. Chicago, for example, didn't shut down the school system. We mimicked New York in that. So it was a sort of a variety of responses. The initial sort of governmental responses were varied across the United States.
Mm. And Chris, what about here in Evanston, like in terms of schools and maybe Northwestern University and movie theaters and churches? Were we quick to shut down here in Evanston or not so quick back in 1918?
So there was definitely a bit of a buffer period between when the 1918 flu was first thought to have entered the Chicagoland area and when Evanston actually began to shut down. Some schools did start taking precautionary measures before the city officially started shutting things down, but there were about 2 to 3 weeks of a sort of buffer.
Mm-hmm. Dr. Rodriguez, what measures were taken to combat the flu back in 1918, and how does that compare to the measures that we've implemented today?
Some similar. One of the things I really it was the Chicago Tribune a couple of weeks ago, reran their sort of explanation of how to make your own mask, which looked an awful lot like some instructions we're seeing today in the newspaper and elsewhere about how to make your own mask. So one was to encourage mask wearing out in public, which now maybe doesn't seem like quite as a big a deal, but if we think 20th century, wearing masks even in a surgical suite was a generally new phenomenon. So the fact that it was encouraging people, even outside of still a very novel experience, was a pretty big deal. So one was wearing masks to protect. Another was to, again, do some shutdowns of sort of large gatherings of people. Another was to encourage things to move outside to sort of reduce the likelihood of spread. So sort of various, I would call social distancing. I'm not sure if they called it that then, but basically some social distancing, as well as making sure that people aren't in sort of confined, because there was concern that it was somehow being spread. There was a huge that it was somehow being spread sort of by sneezing, coughing, et cetera. So similar sort of trying to mitigate that spread that way.
Right. What was interesting to me watching the multimedia video that Chris did is that, a lot of the procedures that the public health experts are telling us to take now are no different than they were 102 years ago for the 1918 pandemic. Now, one of the things that I presume is different is we have a lot more, I would gather, information available to us today in terms of health metrics than we had back then. Could you talk about that, Dr. Rodriguez, a little?
So the health metrics from
like 1918, and how they were measuring, results and how they were doing to our metrics that we're using today.
Well, so to start of saying, influenza was actually a portable disease when the pandemic essentially starts. So spring, summer 1918. Influenza was sort of seen as sort of common and not necessarily a large concern. That changes in the United States in the fall of 1918 to become a reportable disease. So part of this is they actually start collecting information about it to sort of see how the spread is and to consider it to be worried enough to start collecting because actually seeing so many cases of it. So that is a large difference. But, we're still seeing now that data collection still proved to be thing about spread. I just read how Illinois has learned about certain information. Like I think there's a 14-page sheet, I believe, for someone who has COVID-19 people to fill out, including things like their job is, where they live, so that the state can have some sort of idea about are we seeing patterns. The one similarity is the necessity to collect information, the sort of initial sort of what information is important to gather. But then the second is that information can still be difficult to gather for the people who have to gather it. So both cases recognize the information is important and both sort of seeing that it can still be fairly difficult to gather.
Yeah. It's interesting because as we move into the recovery phase, which just started here today under the Restore Illinois plan, we know, and the public health experts know, there will be outbreaks. And so now it's a matter of how do we manage, slowly re-entering, into, more of a normal, there'll be a new normal at the end of this, but a more of a normal for all of us environment. It only works if we've got enough testing out there for people. We have ramping up the testing, but also that we have contact tracing. And what was interesting to me is because you go back to 1918, we weren't doing contact tracing on every single person that got it, because again, it was influenza, it was the flu, it was around, probably didn't think too much, and then all of a sudden they realized, well, we've got something here that's a pandemic, and this is really bad. And what surprised me here is, here we are in 2020. In Evanston, we've done contact tracing since day one, and we've always done it for almost 700 cases now that we have here in Evanston. In Chicago, I just assumed it was being done everywhere. And then it was only a few weeks ago that I learned in Chicago, they were overwhelmed at a certain point and haven't been doing contact tracing. And if you look at the number of cases per capita on a 10,000 basis, in Evanston, we're doing pretty well on that. measure or that metric. And I think contact tracing is such an important part of that. And again, I don't think that was something back in 1918 that we were doing, but even now we're challenged, to do it. Hey, Chris, could you talk to us about back in, let's go Evanston specific, back in 1918, the first time we quarantined, how here in Evanston, like when was that? What month was that? How many cases had already occurred? Were we the first to quarantine around the North Shore or not the first to quarantine? Can you talk to our viewers about that?
Yeah, so Evanston's first quarantine occurred in around early October of 1918. They were actually the last city in the North Shore to quarantine, according to the Evanston News Index, which was a city newspaper at the time. And in terms of number of cases, I could pull up the exact number from my notes, but I do know that the News Index by that point was already running items almost daily about deaths and new cases, and even about some institutions shutting down because of the flu.
Yeah, yeah. No, it's again for our viewers, it's fascinating multimedia. And I remember the numbers. I don't know, maybe because I'm enmeshed in this every single day. And I'm at the Emergency Operations Center right now, actually. And so back then in October, I was really surprised to learn that Evanston was the last community in the North Shore to quarantine. And even then, we didn't quarantine and lock down Northwestern University. That remained open, but we were the last to close schools, churches, movie theaters, which is a big form of entertainment back there. And when we did, we had 200 cases of H1N1 here in Evanston and 22 deaths before they quarantined. One of the issues that I struggled with for a second was whether to declare a local state of emergency when I had 0 cases. I had 0 cases, and yet I saw where this was going because there was obviously the outbreaks out in Washington State, and it was important that people understand that this is an emergency and we need to quickly take action. And so we chose to do that. But I was worried about, will people say I'm overreacting, by doing that? And I don't think now they would, now that it's become what it's become, but at that moment on March 15th. So yeah. And then Chris, why don't you, was that the end of it? So we quarantined back in October 1918. Was that it, or what happened after that?
So later that month, the quarantine order was lifted, and then a few weeks later, World War I ends. So peace celebrations in Evanston and around the country become a big way that the pandemic is continuing to spread at the time. And in Evanston, people also just continue to gather in common gathering places. So things like schools, churches, movie theaters, when those institutions reopen, people kind of flock to them again. And then later on in that year, by December, Evanston is under a quarantine order again. And at that point, there is sort of much less reluctance to quarantine than there was under the first order. In the fall of 1918 in Evanston, some churches were still holding services, and some churches that even weren't holding services, people were still going there to see if anything was going on. Whereas in the winter, when a second quarantine order was instituted, there were items running in the news index about people's personal responsibility to slow the spread of the disease, to keep each other healthy, and to sort of just stay indoors. So that shift in attitude was a really interesting shift between the one quarantine order and the next.
Yeah, that is interesting, and that's something that didn't jump out, or you didn't go into that level of detail in the multimedia presentation, and I think that's good for people to know. So today is Friday when we're filming this. Is Friday, May 29th. I just posted something on Facebook, which was a link to this multimedia presentation that the Daily Northwestern and Chris produced. And I very much hammered home the point that we didn't quarantine once, we quarantined twice back in 1918. I think it's so important for everybody here in Evanston to realize we do not want to revert back and have to go to a stay-at-home order. It's hard enough. The last 2 months have been hard enough for people. And so it's so important that we incrementally and intelligently follow the guidelines of the public health experts and ease back into reopening. Because if we don't, and Chris just described it, if we don't, we may very well find ourselves going down the chute. And I described this whole thing to shooting ladders in a previous Q&A. Almost getting to the finish line and going down the chute and having to start all over. We don't want to do that. Dr. Rodriguez, can you talk about flattening the curve and whether flattening the curve was something that they talked about back in 1918? And, it's certainly an expression that most people didn't know 3 months ago. And now we all know what flattening the curve means. We have been successful at flattening the curve, but we had to do that in order to hope, save more lives because we were worried about our hospitals getting overrun. So talk to us about like healthcare back in 1918 and what they did and were they using that terminology and trying to educate people that way and some comparisons to today.
So I'm actually not certain if they used the term flattening the curve, but certainly they were charting. I mean, that was that's why we know the peak really for the United States is really that fall of 1918 is when it's quite bad. It obviously is circling around the globe a couple more times, but the sort of peak deaths are really in this about 2.5 month window. And you can see these graphs where it peaks and then going down. So they obviously they were charting and following this. I will say kind of on that metric system too, maybe not necessarily flattening the curve, but one thing that really concerned health workers at that time was that this was a W chart for who was getting sick. So we think of right now when influenza more typically was a U chart, which means those most at risk were the very young or the very old. And that was sort of the typical trajectory for who is at risk for influenza. The 1918-1920 pandemic was so particularly concerning because it did a W, which means, yes, it was the very young and the very old, but it was also sort of the 20s and 30-year-olds who were most at risk. So sort of your prime working age population, they're the ones also particularly at risk of getting influenza and particularly of getting, there was a smaller percent if they did get the influenza to actually develop complications such as pneumonia, which then led to, that was sort of the most at risk people.
Yeah, that's really interesting. Chris, can you talk about how did it get here to Evanston? I mean, back in 1918, 100 years ago, we didn't have airplanes. People weren't hopping on airplanes and flying around, and that's a big part of how it can spread today. So how did it spread back then? Can you talk to us about that? And specifically, if you know how it got here to the Chicago area and the North Shore?
Yeah, so a big way that the 1918 flu spread was through World War I era military personnel. And so the Great Lakes Naval Training Station in Illinois was sort of, is thought to be the breeding ground for the way that the flu entered the Chicagoland area. They were also kind of known for having a pretty open policy for having visitors go in and out. And so people would come back and forth from Evanston to the Great Lakes Naval Training Station. And the first case that the News Index reported was actually a soldier who had come down from Great Lakes.
Mm-hmm. Do they have a connection? Do you know if the Great Lakes Naval Training Center had a connection with Northwestern University at that time?
Not that I know of explicitly. I do know that the Northwestern Student Army Training Corps, though, was another place where the 1918 influenza sort of popped up in Evanston pretty early on.
Right. So I think the big question, Dr. Rodriguez, that's on everyone's mind is, we've now learned that there were waves back then of the influenza. We had to quarantine not once, but twice here in Evanston back in 1918. How did the flu end? How did that pandemic end? Was there a vaccine? Did it just fizzle out? There was enough herd immunity? Can you talk to us about that?
So it wasn't the vaccine doesn't. The identification of the virus is 1933. The vaccine then comes after that. So it's not a vaccine that stops this influenza outbreak. A particular one, probably at some level of immunity, that there was some sort of going, because it certainly wasn't a vaccine. So it was a lot of then obviously Chris talking about, there was an element of tracing of who's sick, quarantine. Mm-hmm. At some level it was sort of those preventive measures as well as the isolating people that really sort of stemmed the flow as well as probably a good degree of, people had gotten something, and so they developed a bit of immunity to get it again from getting it. Yeah.
Right. All right. So last question. Both, and I'm going to ask this of both of you. We'll start with you, Chris. What can we learn today from the 1918 influenza?
I think one thing that I definitely learned and took away from the experience of reporting it is that, like I said before, we haven't been here exactly before, but we have been in a similar place, and we made it out even in a time when it might have seemed like we weren't going to. And I know that I've definitely felt that way during this pandemic. So that was one reassuring thing for me to take away. And another big thing for me was just the importance of being willing to quarantine and to social distance. Otherwise, like you said, it will be sort of this chutes and ladders situation.
Yeah, great lessons. All right, and Dr. Rodriguez, what do you think? What can we learn that's applicable today from that influenza?
I think one thing is to think, historians kind of shy away from this idea of that history repeats itself, right? But we can take ideas and to think, for what Chris just said, obviously people have dealt with pandemics before, we've dealt with a major global pandemic before, and so to think that people have come with ways to deal with it. And I think probably one of the biggest lessons for me is to think that they're not necessarily all biomedical, right? This wasn't stopped by the vaccine. This was ended for a variety of reasons, some of which are dealing more with sort of social behavioral of people responding in sort of a collective manner, again, to sort of take care of each other, as well as to sort of do things like wear a mask and or social distance. So to think of a response, not purely biomedical, but that there's a variety of there's political, there's economic, there's social sort of ramifications, as well as addressing of the pandemic that did have a very significant role in ending it.
Yeah, and you can see all that at play here, right? The social, the political, the health, everything. It's very fascinating from that perspective. Well, listen, I want to thank Christopher Vasquez and Dr. Sarah Rodriguez for joining us today. Again, if you haven't had a chance to watch this video, you can find it on the Daily Northwestern website about what we can learn from the 1918 pandemic. My biggest takeaway was that we cannot have large groups of people gather at this point, or we may find ourselves, going back to a stay-at-home order, which is what happened back in 1918. And you can understand why they would all want to come out and celebrate, the end of World War I. I mean, that was a pretty big occasion. And then, William Howard Taft, the former president, coming to Northwestern University, and hundreds of people, or maybe it's 1,000, I don't know, showing up to hear the former president speak. It's not often we have a former president that comes through Evanston. And so you could understand why people gather, but we all need to be very, very prudent about the decisions that we're making and make sure they're aligned with the public health authorities, and keeping 6 feet apart and keeping our gatherings to no more than 10 people while we're all practicing social distancing. So thank you both for the great work that you did, and Christopher for producing it, and Dr. Rodriguez for being a part of that presentation. And as I mentioned at the beginning, Evanston History Center is also doing some research on this, and we'll be publishing something here locally in the near future, which will have even additional information and lessons learned from 1918. So thank you everyone for joining us, and be well.
Thank you for having me.
Thank you.